So the topic of today is black fungus infection. Prevention is better than cure. How do we go about it? So obviously, a stitch in time saves nine. That's a very, very old saying. So any disease, if it can be prevented, is much, much easier and better than curing it, because cure may or may not happen, and cure will take a lot of time, efforts, money, and pain on part of the patient. But if you can prevent it, why not? And this disease, the black fungus that you're listening in the media for last 1.5 months, is actually preventable. If you take a little bit of precaution, it's actually preventable. So everybody is actually, you know, very, very unhappy seeing all these images in the media. But unfortunately, this threat is real. This is not a hoax. This threat is real. So many patients are losing their lives because of black fungus outbreak. So definitely we need to understand what is this disease and how we can prevent it. Wards, the medical college wards are full of patients after COVID. After the COVID wave has come down, they are full of post-COVID patients who are down with mucormycosis. So why it is there? Because COVID actually induces a condition in which the immunity becomes very less. And the worst part in these patients is that they are losing their vision. So though the disease spreads from the nose, it goes into the eyes and then into the brain. So people are losing their vision and many times their lives as well. But if we catch them early when the problem is only in the nose, or even prevent that from happening, we can definitely treat it. So what is fungus? Now, we human beings, we think that we own this earth. We are the only species on this earth. Unfortunately not. Human history is hardly a few million years, old. But the earth is billions of years old. And on this earth came the small bacteria. When the life started, small bacteria, small plants, and something which is between the plants and animals, that is the fungus. So fungus are the oldest organisms on this earth because they are most resistant to temperature. They are most resistant to all kind of insults that the environment can provide. Like we human beings cannot exist between, say, 20, we cannot exist over 50 degrees centigrade. We cannot exist below 0 degrees centigrade. We need very, very small temperature range to sustain. Most of the animals would also require temperature range to sustain, but these are fungi. These can sustain a very, very wide variety of temperature, and therefore they are the actual inhabitants of this planet Earth and not us human beings. And therefore they are really resilient. They are resistant to a lot of treatments that humans have actually also tried to get for this fungus. Hot and humid climate is the most, is like a petri dish. Fungus will grow very, very fast in hot and humid climate. And our country, most part of our country, especially the southern part, the western part, and the central part, if we leave away the extreme north part, most of our country, including the east part, is hot and humid. So our whole country is an ideal, country, or their ideal conditions for growth of fungus. And therefore, we see fungus very, very fast. Every day, you leave your bread outside for a couple of days and you'll see mold growing on it, and you'll have to throw your bread. Is there anyone who has not seen this? So fungus is there everywhere. It's there in the air. We all inhale it every day. So the moment it gets an ideal medium to grow, it will grow. So why doesn't it grow in our noses if we inhale the same air which is there on the bread? Because our immunity is strong and we have the body immunity to kill or not let the fungus grow inside. So we have to understand the moment our immunity is lost, our nose becomes like this bread and fungus will start growing on that. Okay. So there are lakhs and lakhs of millions of species of fungus, all different varieties, right from the heights of Himalayas to the bottom of oceans. We have fungus everywhere and all varieties, from the smallest of the spores to the largest of the fungus. We have all various different millions and millions types of fungus. Some are very useful. Don't we use yeast to grow, make the bread? This is also fungus. Dry yeast is a fungus. Mushrooms, a very, very nutritious vegetarian product for our consumption is mushrooms. This is fungus. So these are the fungus which are useful to our life, but there are many fungus which are actually poisonous. Many mushrooms are poisonous. So out of the millions of species, there are some fungus who are useful, but most of them are actually harmful. And when they cause problems, they can cause very small problems like a small fungal infection of the skin, and you use that powder in your armpits, or you use some cream. That's also a fungal infection, but which is very, very not a very notorious one. It's very common. Almost everybody would have faced some fungal infection in the armpits or somewhere in the skin in the lifetime, and you might have applied some ointment. That's also fungal infection, which tries to invade your skin, but this is not serious. Then as a ENT in the rainy season, I every day 4 to 5 patients I clean fungus in the ear, because ear canal, the moisture gets trapped, and there's a lot of sometimes wax and some debris, which is a dead material. So fungus obviously will try to settle on dead material and then grow on it. So that's called fungal infection or automycosis. We have hard time cleaning ears of patients. Now rainy season is going to start in few days. Our problems will start. So we keep on seeing. But again, this fungus is generally not serious because the body immunity takes care. If the body immunity is not, the same fungus will go and invade everywhere. Oral cavity. Many a times you would have got oral ulcers. I do not want to show you any bad images, but this is oral cavity. You can see the tongue. You can see the you get those curd-like patches. These are called oral candidiasis or oral fungus. This is again very common. Those who are using puffs, they get this condition. Those who are having diabetes or anything, they get this fungus. And you give some medicines and gargles, this goes away. Now, fungal infection of the sinuses. Being an ENT surgeon, last 22 years of my ENT practice, I have been operating left and right on sinuses of the patient endoscopically. I am not showing any bad picture. This is just one picture. I'm showing that fungus is very common inside the sinuses. So these fungus generally would not invade. It will stay in the sinus and just give you some swelling, some pain, some discharge, and that's it. It will not grow. It will not invade the bone, and it will not go into the brain. It will not go into the eyes. So this is normal fungus. In fact, fungal infection of the sinuses are of 4 kinds. Why it's important for me to tell you, you're not doctors. It's not my job to teach you ENT, but what is right now being taught is in the media is about the invasive fungus, which will erode the bones and go inside the sinus. Fungal infections of 4 types. One is simple allergic infection of the sinuses, in which the fungus is staying. Fungus is there and causing allergy. So you have all the symptoms of allergies, sneezing, polyps, and you are sneezing like crazy, and you take some medicines, you are better. That's called allergic fungal sinusitis. It's very, very common. People who have got good immune system will have allergic fungal sinusitis. It's very common. Then there's called fungal ball in the sinus. Fungus is just sitting there and just creating some heaviness. Years and years together, months and months together. That's called fungal ball of the sinus. We remove that fungus and matter is over. It will generally never create a big problem. Third is chronic indolent sinusitis. That means the fungus is growing, but very, very slowly. It's eroding, but very slowly. Gradually, the eye will pop outside, but you'll have enough time, months. And the fourth one is the fulminant one, which you are right now facing, is the black fungus or mucormycosis or the fulminant sinusitis, where fungus will very aggressively behave like cancer, will go into the eye, will go into the brain, and will kill the patient or will take away the vision. So these are 4 types, of which commonest are the earlier one, first and second are the most common. Third and fourth are rare. The rare one has become common right now because of the COVID. I'll come to that. So out of the 4 varieties, if the immunity is very good, then you'll get the allergic fungal sinusitis. You'll have all the allergy features. Or you'll have fungal balls sitting there doing nothing big because it will not be able to cross the sinus bones. If the immunity is lowered, then you will have the fulminant variety. When the immunity is lowered, if somebody has got diabetes, which is uncontrolled diabetes, high sugar, somebody has got a renal transplant, any organ transplant, then you are put on very heavy medicines which decrease the immunity. There are many, many more other conditions, some cancers and this and that, but I'll not get into that. The two common things that you remember decreasing immunity is diabetes and in organ transplant. So diabetes is very, very common. Almost 6 to 7% of the population is having diabetes. So we'll concentrate on diabetes. If your diabetes is not controlled, then your immunity is low. And then you are prone to a serious fungal infection, which is the black fungus or mucormycosis. What happens in COVID? Even people who are not diabetic, those who are having diabetes, they definitely can have a problem. Even people who are not diabetic, their immunity is also lowered by COVID infection itself. I'll not go into the detail how it creates. It's a scientific subject. You can remember that COVID-19 by itself decreases immunity. On top of that, you have to take steroids for the treatment of COVID-19. So your immunity is further depressed. And the third factor, which is very, very important, that somehow, without going again into the detail of how it causes, the COVID infection causes a release of iron. See, our blood cells have got iron, hemoglobin, the blood cells, the blood that we is flowing 5.6 liters in our body consists of blood cells, and those blood cells are made up of hemoglobin. Hemoglobin is heme and globin. Globin is a protein and heme is the iron. So our body has a lot of iron. And what happens is that this COVID causes blood clots. It via various other mechanisms, it frees the iron. So there's a lot of iron in the body, and this fungi needs iron. Why this fungi can grow in very high temperature, in depth of the oceans, in Himalayas? Because they thrive on things like iron. They eat iron. So because the iron is too much available in our body during COVID infection, which is not otherwise available. So during COVID infection and immediately after COVID infection, there's a lot of iron in the body available for the fungi to eat. These are the hypotheses, 2-3 hypotheses which are being given for this infection of this outbreak. So why it happened in our country? Because hot and humid climate, we have a lot of fungi which are inhaling every day. The COVID, this wave took everybody by storm. A lot of steroids were used in this wave, which was not used in earlier wave, because steroids were started, in August, September. By that time, the wave was already coming down. So the first wave, so much of steroid was not used. In this wave, everybody was using steroids left, right, and center. So steroids, and then some people had to use oxygen. So I'll show that. So when COVID patients are admitted in the ICU or in the ward, they're giving a lot of oxygen. And those who are diabetic and suffering from coronavirus, or in fact, even those who are not diabetic, the stress levels are increased. So the blood sugar is increased, their immunity is lowered. So these people, coupled with, everybody is being given tons and tons of steroids, because that is the mainstay of treatment. Because steroid is the only thing which prevents the clots from formation. So you give anti-platelet and anti-clot agents along with steroid to reduce the reaction. And this steroid, on one hand, increases the sugar, on the other hand, it decreases the immunity. The lymphocytes, the blood cells that are in our body, which are responsible for immunity, is lowered by steroids. So this dangerous combination leads to growth of fungus. And then these patients are given a lot of oxygen. Oxygen comes through oxygen cylinder. It is to humidify the oxygen. It passes through the saline. Now this saline most often is not changed very frequently. It should be changed every day. But in our hospitals, same saline, it hardly takes 2 rupee, not even 1 rupee of saline to be put in. But it's just a matter of habit that the ward boys are not, nurses are not used to changing the saline. So there was also some reports that industrial oxygen was being used, which was not properly purified. So how much is the truth in all these things is yet to be established. These are all hypotheses, but we have to accept whatever is in front of us right now. So whether it is impure oxygen, whether it is impurity coming through the humidifier, or whether it is the lowered immunity, these patients, after suffering from the COVID, the body immunity is less, they get this fungal infection of the sinuses. So now, how does it present? What are the symptoms? And I will definitely not go into the treatment, because treatment is not the idea of discussion. Idea is how to prevent. So what are the symptoms and how do we prevent? So the first symptom that a patient of post-COVID, we are talking right now of post-COVID, because otherwise the mucormycosis is very, very rare. So it's no point talking about that. But post-COVID, there are almost more than 10, 12,000 patients in the country right now, which is an underestimate. So first thing is nasal discharge. On the affected side, it can affect both sides, but commonly it affects one side. So on the affected side, there'll be some watery discharge or some purulent discharge will be coming from the nose. So the patient will have some cold-like symptoms. There'll be some pain, some cold-like symptom discharge, and pain on the face on one side generally. On both sides maybe, but most commonly one side. And pain will be mostly on the cheek, because maxillary sinus is the first sinus to get affected, because that's where the sinus can stay. So just below this sinus is the teeth. So the patient can have pain here on the cheek, the patient can have pain in the teeth. So pain on the cheek, pain in the eye region, pain in the teeth is the first symptom, along with nasal discharge. This is what we have to remember. And sometimes there'll be swelling below the eyes. That swelling may or may not be significant, because by the time it becomes significant, it's quite late. So you'll have a little swelling, there'll be pain, there'll be discharge, there'll be teeth ache. That is the warning sign that should warn you that if you might be having COVID in the past month or so, and if your sugar was high, if you had been given oxygen, if there was steroid injection, then you should definitely think and rule out black fungus or infection. Obviously facial swelling, when it increases, then obviously it comes to the eye part Dr. Nita is going to deal, so I'll not deal with the eye part. And when the discoloration of the skin starts, then by that time it's too late. So do not wait for the discoloration to, this is diagnostic, but this is too late. That means the fungus is already invaded the bone of the sinus, it has already come to the skin, and it has already taken away the vascularity, the blood vessels. So I'm not showing you very gross pictures there. This is the best picture I can show you. Others are actually much gross. So this stage is actually late. So by the time you have discoloration, do not wait for that. And sometimes you can see some black spots on your palate also. So that again, seeing those black, therefore it's called black fungus. The fungus is actually not black, because it plays with the blood vessels and it causes the ischemia. That means there is no blood vessel. The area of the body where it infects is dead, because the dead area turns black. Therefore, it's called black fungus. It acts by blocking the blood vessels. You might have heard during COVID, a lot of people get heart attack because there was a big clot in the heart, a big clot in the lung vessels. In fact, my own uncle, my mama, he expired. He was maintaining saturation till 92 very well, and suddenly he got a massive pulmonary embolus and heart attack, and he was dead. And many people have died of heart attacks even after coming out of COVID. This is because of the blood vessel blockage. So this fungus also blocks the blood vessels. So COVID actually destroys the blood vessels, so the fungus gets a chance to destroy the blood vessels even more. So when you grow the fungus in the petri dish, it will not look black, it will look brown. So why it is called black fungus? Because the area turns black, and the area turns black because the area becomes dead, and the dead area, no medicine will work. So though there are so many injections called amphotericin B, then we have posaconazole, then we have another type of zole tablets, but first of all, they are in very short supply. Why? Because this kind of fungal infection was never seen in the country, so the companies were not producing that amount. Second, the moment this epidemic started, everybody started hoarding. So even some of our politicians were in the business of hoarding these medicines and selling in black market. So an injection which was of 5,000 rupees is selling for 20,000, 25,000 rupees. So though there are medicines, and if you treat early, the results can be good. But when the infection goes from the sinus into the eyes, then the eye has to be removed. When it goes into the brain, then only God can save the patient, because you cannot remove the brain. And anything which is dead, which the medicines will not work, and only treatment is the surgery. So endoscopic surgery is done by ENT surgeons, because that's the area when you remove all the sinuses. Sometimes oculoplastic surgeons, Dr. Nita will come on that, also help to remove that part of the orbit or the eye which is affected. And sometimes a neurosurgeon is required to open up the brain. But obviously, all these things are really, really gross. I will not show any videos. Those videos are absolutely, heartbreaking. I would not like to show you any of them. Prevention is better than cure. So how can we prevent this from happening? First of all, if you are not, if you have never contacted COVID, please prevent yourself from getting COVID, because COVID is one thing which is going to lower your immunity. So we all know washing hand, using soap, not shaking hand, using disinfectant, avoiding contact, and keeping safe distance. We all know about it. There's nothing new that I am going to tell you. But out of all this, two most important things are using a proper face mask, a mask which fits well here, which fits well here. The quality of mask N95, N99, this mask, that mask is less important. What happens, you're using a very good quality mask, but it's loose and the air is going from here, the air is coming from here, that mask is of no use. Now they are talking of two masks. What two masks will do if both the masks are just hanging? So best mask is one which will fit your nose and mouth pretty well, and it will tie behind the back. That mask is the best. If you have a mask which is N95, great, nothing like it. But even N95 mask has to fit snugly so that the air does not escape. That is the most important thing to prevent from, obviously, viral, bacterial, fungal, all infections. Second thing is using your hands, because see, as I said, fungal spores are there in the air. You cannot stop them. But when you touch anything and take you near your nose, you are using bacteria, fungus, virus, everything is going inside. So use these two are most important things. If you had COVID, if you have COVID, if one of your family members have COVID, and most of the members, most of the people will be, say, 78.5-80% will be treated at home, don't use the steroids, because steroids are only required in the second week. First week, no steroid. Because what happens when the virus hits you, the body defense is going to fight against the virus. The moment you give steroid, the body cannot act against this virus, and the virus will grow multiple times. So no steroids in the first week, and even in the second week, less or no steroids if you are getting treatment at home. But yes, if your doctor has advised, then in the very prescribed dose, in the smallest amount possible, take steroids. If you are taking steroids, monitor your blood sugar. Even at home, even if you're not in contact with anybody, even in a room, use mask to prevent that fungus from getting inside your nose, right? These are the things that you can do at home. And when you get us outside, in your room, what is most important? AC. Your AC is full of fungus. Get it cleaned, get it serviced. Your air conditioner, because there's a there's a filter which will filter the air, and this air is circulating, and there's a lot of moisture. This is full of fungus. This is the hottest spot for fungus. Your car AC in your room AC. So even if you're isolated in the room, even if you're going alone in the car, your fungus is behind you. So please get away of this fungus by simple getting your AC serviced frequently. Then the best thing you can invest is a vacuum cleaner. How much it costs? 5,000, 10,000, 15,000, depending on whatever model you choose. Because you clean your house, you clean anything, you clean your bookshelf, there'll be dust. Dust will have lot of fungus. So if you use a vacuum cleaner, you will not inhale that amount of fungus. What is the fun in inhaling fungus and taking allergy anyways? So use your vacuum cleaner on your carpets, on your curtains, on your upholstery, on your pillow. The pillow has a lot of fungus. So clean up your pillow, wear mask, then clean up your pillow, put it in the sun. All your upholstery should be very, very neatly cleaned. Your bookshelf, your old books, your almirah, your old clothes, everything has fungus. Let a lot of sunlight come inside. Sunlight will kill a lot of, moisture will be less. If there's less moisture, remember, warm and humid climate. If the moisture is less, fungus will grow less. So moisture is required for the fungus to grow. So open your window, let the sunlight come in as much as possible. You'll prevent a lot of fungal infection. Do not reuse mask a lot of time, because if you keep on reusing the same mask, this mask will contain all the moisture everything which you have inhaled and exhaled, and you go home, put up this mask again, next day use it, either throw it or at least you sanitize it. So use a sanitizer. How much does this sanitizer cost? 2000 bucks. And how much is your fungal infection going to cost you? 15 lakh, 20 lakh. Still your life may not be saved. So it's absolutely a no brainer. Use simple things to prevent infection. That is the most important. If you have cold, if you're prone to cold, if you're prone to allergy, go to your doctor, take anti-allergic spray, take anti-allergic tablet, because see, if your nose is full of mucus, all fungus will settle inside. If you're breathing freely, if your nose is not full of mucus, fungus will not set inside. So if you're prone to allergy, then treat your allergy, go to your doctor, take some anti-allergic tablet, take some spray, use a lot of nathi or nati, whatever you want to call it. We give a lot of nasal saline. So if you use neti pot, neti, whatever you want, gel neti, whatever you want to call it. So whatever goes inside, you'll clean it. If you do it 3 times a day, fungus will not get a chance to settle over there. Simple. There's no medicine. You use, we have good nasal washes, medical nasal washer. If you do not want to use the native pot, we have good nasal washes your chemist will give you. So you use the nasal washes 2 to 3 times a day and fungus will not stay inside. If you have a condition which is predisposing you to fungal infection, such as if you have a sinus problem, if you have a deviated septum, in last, I think 2 weeks, I have seen a lot of patients who came for the fear of fungal infection, who did not have anything, but because of the deviated septum, they were having pain, little bit of sinusitis here and there. So some patients suffered a fungal infection. One patient actually got mucormycosis, had to be operated. He got it on the bad side, because that side everything was getting accumulated. So if you have a deviated septum, you have seen a doctor who has recommended a surgery, do it. It's a simple surgery, half an hour surgery, 1 week downtime, and you are good. If you do not do it now and you get a fungal infection of the sinuses, which become, which will go near the eyes and the brain, you unnecessarily suffer. So when you grow old, I have a lot of list of old patients, 70 plus, who want to get operated. I cannot operate because now they are on blood thinners. Somebody has a heart problem. So in your young age, if you have a nose which is blocked, which remains blocked, your mouth breathe, not only you get sleep apnea and snoring, you are also prone to fungus. So if you have a nasal problem, do it in time. A stitch in time will save 9. Remember this. So this very small surgery will save you a very, very big surgery at a later age. Then control your sugar, have a healthy diet. That's the most important thing to improve immunity. Your sugar has to be controlled, your diet has to be good, and obviously all the colored food, fungus colored are not good, but good food which are colored good are good. So all the colored food are good, the white ones are not good. White is sugar, potato, all those things are not good. Rice, have less and have all those colored food. Do your exercise, do your walk, yoga, whatever you want to do. And if your sugar is not under control, if you're diabetic, believe me, go for insulin. A very nice quality insulin pens that does not hurt. I am taking insulin for the past 1 year. I'm diabetic for the last 15 years. Gradually, my sugar was not getting controlled. In last pandemic, I started on insulin because I wanted my immunity to remain good. So there's no harm in using insulin. Insulins are best. They have very good quality insulins available once in a day, twice in a day, whatever your doctor suggests. Insulin are better than tablets. So my sincere advice to all the diabetics and relatives of diabetics, please think about you starting insulin. Ask your doctor. I'm not a diabetologist, but ask your doctor, start on insulin. It will actually make your life much, much better and easier. And your immunity will be boosted because your sugar will be better under control. Good sleep is very, very important. So टेंशन छोड़ो, आराम से सो. जो होना है वो कल होना है. आज रात तो सो जाते हैं. That should be the motto. You should not waste your night in thinking what is going to happen tomorrow. You cannot control it. And family support, good family life, and music, hobby. So basically all this will have boost your immunity. But still, if you have those symptoms which we just talked about, see your doctor. The first test will be done is a nasal endoscopy. So you straight away go to an ENT nearby you, and he'll put an endoscope and straight away see if he can see fungus or any changes related to fungus. He'll immediately let you know about it. If there's nothing, you can relax. And if required, an MRI, not the CT scan of the sinuses, MRI of the sinuses is the investigation. Beyond this, I do not want to tell, because beyond this is the prerogative of the treating doctor. So your ENT, your physician would be the right doctor to treat you. But MRI of the sinuses and nasal endoscopy. Nasal endoscopy is the first one, and MRI as the second. These are the two tests which need to be performed if there's a problem. And if there's a problem, obviously your doctor will take further from there. And my job ends here by telling you how to prevent getting infected with the black fungus. Thank you very much.